Good morning. So what we'd like to see just in terms of health professional learning opportunities related to social determinants of health is that there's a really a first nature understanding of the importance of understanding of the social determinants of health across the professions, that there are plenty of learning opportunities, that there is interdisciplinary collaboration in terms of as folks get educated and they practice that becomes first, not second nature, and that there's an emphasis on educating the patients and the families, and that's seen as a core and pivotal, and then that there's plenty of tools and resources that are available to folks. And these are things that we all know in terms of understanding the social determinants, that there are social, ecological factors that impact our health, and it's across a wide range of things from urban planning, sanitation, engineering, to epidemiology, clinical sciences, and that we need to understand that all these factors impact our health. And then as we understand those factors, understand that there has to be a need for political change, and that part of our responsibility is advocacy work. It's not just the clinical work, not just the administration, but doing the policy work that goes with it. And that eventually we want to get to population-based health, where we're actually looking at those challenges, looking at it by groups and by communities, and that we're actually collecting data and analyzing data and looking at how to impact populations so we can have more sustainable health. And as we address these social determinants, there's some promises of better outcomes that we want, a better patient experience, a better experience for clinicians, and then the things that we all care about in terms of people being treated in their homes and their communities, less reliance on the emergency services, and that we see value for value in terms of we can stretch our health dollars and more people can be served. And we want to have a sort of a holistic approach, that we're seeing the person in the context of their environment and their family, and that we're looking at health promotion practices, incorporating that into our clinical practices, and that we are looking at data-driven, evidence-based interventions, not at just the individual and family level, but at the group and community levels. Some examples of some opportunities within the social work, looking at curriculum, how can we infuse interdisciplinary practice into the curriculum and also into our field placements. And I just gave a little credit to the Council of Social Work Education. They're working with our schools of social work to make that happen. An example there is the University of Michigan and some of the work they're doing. We've got some projects. We have a project that we modestly call Social Work Heals, and it looks at preparing BSW, MSW, PhD, and postdoctoral level students to deliver evidence-based integrated health care. And we're actually, through NASW, the Council of Social Work Education, and New York Community Trust, we're going to build a network of social work educators across the country and students where they can begin to support each other, and then we can have that network of folks just grow and grow over time. And we're also looking at a project looking at social work supervisors in aging. Some of our study has shown that after being in the field for quite a bit of time, those MSW level folks are still saying that they need more knowledge on serving aging, and they also need more knowledge on how to be good supervisors. And so we've got a project, and it's across 4 sites that's working on that. We want to see the interdisciplinary collaboration, and we'll know we've got it when we have one patient and one plan versus having one patient and 15 plans. And we actually can do it. Just an example of some work we did in child welfare, we had a notion of it's one family, one plan, even though we have 5 agencies working, and we actually were able to get on the same page and have one plan. We want to make sure from a consumer standpoint that the consumer is feeling like they're having a better experience in terms of access, in terms of being able to have treatment preferences. I was in a cab yesterday, and the cab, he says, "Where are you going?" I said, "Here's where I'm going." He says, "Well, you know, I'm on a new medication, but my new medication won't be paid for because of insurance." And he says, "Why does the insurance not pay for it?" I said, "Well, you need to talk to the patient advocate, the case manager, have someone inside the insurance company advocating for you. They need to understand that you can't go 3 times a week to get your blood drawn, but this new medication only requires you to do it twice a month. So you need to advocate for yourself." But so the patient can feel like they're having the kind of experience that doesn't impede on the rest of their life, but lets them be able to have a better quality of life. We've got hurdles to overcome, and hopefully the framework will help address those hurdles, whether they be financial or issues of transferring of information. And we know that we need more practitioners in the field who actually have the experience and expertise to be able to be the mentors and the teachers. And we know we need more field placements, places where folks can go where there is integrated delivery of care. I'm trying to get to my last slide. And we really want a model of population health eventually where we think about the person and environment. We think about them from terms of the integration of mind, spirit, and body, and that we consider the person in the context of their community, the context of their culture, the context of their family, and then their lifestyle. And then we know there's all these social determinants of health that impact on a person. Sometimes it can be as simple as, the transportation. How do I get back and forth to my appointments? How do I get back and forth to get my prescriptions? Who's going to support me? I don't understand why I need to take these medicines. Who can help educate me to where I can understand the role that it plays? In some cultures, if you take a medication for 2 days and you don't feel better, you say, well, it doesn't work. And to have folks there to support you through that.